A major scientific meeting of the year, the Union World Conference on Lung Health that looks at tuberculosis, its treatment, new development and advocacy is what is keeping track of this disease. The International Union Against Tuberculosis and Lung Disease specially looks to addressing health challenges in low and middle income countries. Granted, there has been progress towards some of the Millennium Development Goals. Not so much for goal number 6 of combating HIV, malaria and other serious diseases like TB. It demands that by 2015 the instances be cut by half as well as the deaths. For TB, it seems this is a long way off.
1/3 of TB patients are not diagnosed or not registered. That means they aren't being treated. 1 out of every 6 patients with tuberculosis will die. That still means that we just have a lot of work to do.
This work was highlighted by some of the scientists during the 43rd Union Meeting on Lung Health in Kuala Lumpur, Malaysia. Many researchers and scientists appreciate the fact that there have been medicines to help with tuberculosis, but they say that these are decades old now and there is need to find newer medicines.
The way you diagnose in most of the countries right now is through smear microscopy, which is exactly the same as the Robert Koch was using 100 years ago. So indeed, if Robert Koch comes today, he might be surprised by your camera, by our clothes, by the mobile phones, but he will not be surprised by the way we deal with tuberculosis.
We thought we had all the tools we needed to solve this disease, and we were clearly very wrong.
The World Health Organization, WHO, declared TB a major public health emergency in 1993. There is more TB now than there was in 1993, with almost 9 million new infections each year and 1.4 million deaths globally.
The most exciting latest thing are 2 new drugs that have been developed, one by the company Johnson & Johnson, the other by the Japanese company Otsuka. One is called bedaquiline and the other is delamanid, and they've been developed for patients that have drug-resistant TB.
Regarding diagnosing the disease, there is a new molecular test called GeneXpert, which has been endorsed by the World Health Organization and is being rapidly deployed in many countries.
This makes the ability to diagnose TB and resistant TB with only an hour or 2 of work in any place with electricity, and that's a phenomenal breakthrough.
The current treatment of TB is 6 to almost 30 months. According to the TB Alliance, new treatments in development are looking at shortening this period to between 2 and 4 months only. The Alliance also has a vision looking at 7 to 10 days of treatment. Even better than newer drugs will be finding a vaccine for TB.
You can give just 1 or a few shots and keep people from getting the disease, as opposed to waiting till people get sick, pass it on to others, get diagnosed, get brought into the health system, and then have to go through treatment.
The only available vaccine is Bacille Calmette-Guerin, BCG, which was developed about 90 years ago.
And it's effective to prevent the non-pulmonary form of TB in children, but it doesn't really have much effect later on in adults.
According to the WHO Global Tuberculosis Report 2012, 11 vaccines to prevent TB are moving through development stages. Judging from the progress in the past 10 years, 1 new vaccine could be licensed in about 7 years' time. The most advanced preventive vaccine in development, called MVA-85A, is in the phase 2B trial, which is just finishing up. This is a stage which leads to a final bigger phase 3. It is being tested in babies.
It's a vaccine that was first developed at Oxford University in England, and now Oxford University and a biotech company in the United States called Emergent Biosolutions and Aris are all working together to test and develop this vaccine. And it's very exciting, major milestone for TB vaccine development, because we're going to have that first human protection data in the first quarter of next year.
Tuberculosis remains the second leading killer of people after HIV and AIDS, and this year advocates started a zero campaign against TB deaths, infections and suffering. Newer drugs are in the pipeline. Diagnostics as well as vaccines are being developed. These may be able to contribute to faster achievement of the zeros, But for the past 3 years, there is something that has been introduced by the Union as well as Médecins Sans Frontières or Doctors Without Borders, called operational research, the science of doing better.
It comes from the military and commercial sector, where it was used to improve performance. Now in the health sector, it has been very little used, but it is so important now where resources are limited and where the burden of disease is very high, like in Africa, Asia, and so on, that we improve the performance of our health programs.
Put simply, operational research shows what works and what does not work and tries to find solutions to a problem. It has to be an integral part of the program which makes sure that drugs are accessible, affordable, and they are taken the way they should be. Even if an efficacious vaccine against TB were to be rolled out, operational research would have to be at play. A mistake of compliance was made in the past, and it is not about to be repeated by any scientist. Florence Naluyimba, NTV.